Okay, there we go. Okay, so just a couple of housekeeping things. It would be great if you could keep your microphones on mute and your videos off unless you are speaking. I do have the controls, so if you accidentally unmute yourself during a presentation and I hear noise, I will mute you. Otherwise, during the discussion section, you'll be able to unmute yourself and have the opportunity to speak. Okay then. So today's webinar. So I'm going to just give the introductions to the presenters first and overview of the objectives of the webinar. And I will then give a very brief presentation on the Tech RRT. I know a lot of you online will be familiar with what we do already, but some of you may not. So for those who already know, please bear with us whilst we just go through only a few slides on the work that we do. And then we are going to hear about the context for the deployment, the background, the humanitarian context in South Sudan, and the rationale for the deployment. And following that, we're going to hear from the Tech RRT advisor, who is going to detail the deployment itself, looking at the terms of reference, the achievements of the deployment, the challenges that were faced, the recommendations, and finally, the ongoing activities since the deployment. And then, so those presentations will take roughly altogether about 45 minutes. And then we're going to have a discussion session that we will do our best to stick to the time and preserve so that all of you who have attended today, and I'm very pleased to say that we have a great turnout, are able to ask the questions and have a discussion about some of the issues that are raised. And on that note, if you have any questions throughout the presentations, please feel free to type them into the Zoom chat box, and we will come to them during the discussion session. That would be very helpful. And we may, depending on the question, I will either read them out, or we may, like I said before, ask you to say the questions yourself. So as I said, please feel free to put any questions, comments, observations in the Zoom chat box at any moment throughout the presentations. And finally, we will ask you at the end, I'm asking you now, and if you could, at the end of the webinar, please fill out a very quick SurveyMonkey evaluation about the webinar. This is really critical information for us to make sure that we can improve the webinars and make them more appropriate for practitioners like yourselves. And it will take you a maximum of 10 minutes. According to SurveyMonkey, the average time spent on this survey is 6 minutes. So if you're quick, it'll take much less. So that will be much appreciated. And I will share the link with you before the end of the webinar. Okay then. So today's presenters, as I said, myself, I'm the Deputy Program Director of the Tech RRT. And we are also very fortunate to have Priscilla Bio, a nutrition specialist with UNICEF in South Sudan. She was one of the people very heavily involved in this deployment through the conception, the design, the implementation, and also the follow-up. So we're very glad to have her on the line today to present for us. And we also have Yasir Arafat, who was the Tech RRT IYCF-E advisor. So he was the one who facilitated and supported the country team with this deployment. And he is a nutrition advisor with Save the Children. Okay. And so Priscilla and Yasir, maybe can we hear from you? Maybe.
Hello everyone, I'm Yasir, and it's pleasure to be here and joining the team here to present my experience in South Sudan. As already Ben introduced all the backgrounds, so I think I would stop here and then we'll wait for the team.
Great, excellent to have you here, Yasir. Thank you for joining us. And Priscilla, are you there?
My pleasure.
Hi everyone, this is Priscilla Bayo. I'm glad to be here today to talk to you and listen to all of you. Thank you.
Great. Thank you, Priscilla. We will come back to you very shortly. So, the objectives of today's webinar. So they're quite straightforward, the objectives of our post-deployment webinars. Firstly, to foster discussion on the situation in the country, on the IYCF-E specifically for this one, the IYCF-E challenges that are being faced and how the country, the organizations, the government and the UN organizations are dealing with those challenges. And secondly, to share information specifically about the TechRRT IYCF-E deployment to South Sudan. And we hope that we have people from other countries on the line, and that the learnings from this deployment can influence other responses elsewhere. And thirdly, to improve the follow-up of the work done during the deployment. The TechRRT deployments are only a short exercise. This one, we'll get to it, was 8 weeks or so. And the intention is that that work builds on and facilitates further work in the country. So we hope that these webinars, as today, can facilitate that process. So one thing I forgot, it would be really great to give everyone on the line an idea of everyone else who is on the line. If you could type in your name, organization, and the country that you work in the chat box, then that would give everyone the opportunity to know who we have on the line. So I can see your names, and I know many of you are familiar, but it would be great for the benefit of everyone else if you could just type them, your name, organization, and the country in which you work in the chat box. At any moment from now. Thank you very much. They've started coming in. That's great. All right, so well, I'm not going to wait for you to do that, but if you could, that'd be great. I will continue with a brief presentation on the TechRRT. Okay, great. So the TechRRT, what is it? So simply speaking, the TechRRT is a technical rapid response mechanism that supports improved nutrition program through 3 different areas of work. Firstly, deploying advisors to provide direct technical support. Secondly, providing technical support but remotely. And thirdly, developing and providing capacity strengthening initiatives. These are quite broad in their characteristics, but you may have attended some of our capacity strengthening webinars, for example. So, and who are we? We're a consortium of 3 NGOs, International Medical Corps, Action Against Hunger, and Save the Children. And each of the advisors are hosted by one of these organizations. And we're very fortunate to have funding from 3 different donors, OFDA, USAID, Irish Aid, and CEDA. And we work very closely with the Global Nutrition Cluster to identify technical needs at country level, and also with UNICEF. And I should also mention that we are part of the GTAM, the Global Technical Assistance Mechanism for Nutrition, that is currently in its build phase. And if you are a nutrition practitioner, and if you haven't already heard about the GTAM, you will certainly be hearing more about it. So, and what's the goal of the TechRRT is to improve and strengthen the technical quality of programs and assessments for improved nutrition outcomes of affected populations in both emergencies and protracted crisis situations. Okay, and what do we consist of? So firstly, we have a program management team that is myself, Ben Allen, I'm the Deputy Program Director, and my colleague Andy Kendall, who is the Program Director. And we oversee the activities of the TechRRT. And we have 4 technical advisors, each of them with their own technical speciality, First, we have the Survey and Assessment Advisor. Her name is Alexa Humphreys, and just to give you an idea of the work we do, she has recently been in Zambia supporting the country to set up systems in order to implement smart surveys in the country. And secondly, we have a CMAM, Community-Based Management of Acute Malnutrition Advisor. Her name is Martha Nakakandi, and she is currently in Zambia, working with UNICEF and the government to build their ability to respond to the drought situation at the moment with the CMAM program. And secondly, we have an IYCF-E advisor. Her name is Brooke Bauer, and she is currently not deployed. And I will take this opportunity to say that she was deployed in Jordan recently. And on January the 8th, we will be having a post-deployment webinar on her deployment to Jordan then. So if you want to hear more about that one, obviously a very different context to this one in South Sudan, then please join us then. You will hear more about it. And finally, we have a SBC advisor, Social Behavior Change Advisor. Her name is Sona Sharma, and we're very lucky that she will be starting with us on the 1st of February. And we're very keen to let people know that we are reinstating our SBC capacity. So if you or you know of any organizations that may need SBC support, then please let us know, as is the case with the other technical areas. And finally, we don't just rely on those 4 advisors, we recruit others. We have a standby list of consultants who we're able to draw upon if the needs for support are beyond the capacity, availability or profile of our 4 advisors, then we recruit them. For example, we have had 2 consultants helping, supporting deployments in Angola, an assessment advisor, Lourdes Vasquez, who has been helping UNICEF and World Vision and the government with implementing a smart survey in Angola. She's still there, and that's coming to a close in the coming days. And we've also had a CMAM advisor, Jose Luis Alvarez Moran, in Angola, again working with UNICEF and the government to build their capacity to respond to CMAM, the capacity of the CMAM program. And finally, we have a deployment steering committee, and they help us to refine and make sure that the work that we're doing is appropriate and adapted to the global needs. And they consist of the consortium partners and UNICEF and the GNC. And each TOR that we produce, those 5 organizations will input on those. Okay, moving swiftly on. Just a quick overview. So the TechRRT has existed since 2015. And on this slide here, you can see the 21 countries and the characteristics, the thematic area of 58 deployments that we have done. This is up to date, including the aforementioned Zambia and Angola deployments. And we hope and we expect to be delivering many more deployments in 2020 and beyond. And finally, just a quick overview of how you can request the TechRRT. So any agency, national or international, or other stakeholder with nutrition technical need can request support of the TechRRT, whether it's donor, government, nutrition clusters, sector groups, or national organizations. And we put an emphasis on national organizations because we are making every effort to try to provide to identify technical need amongst national organizations who tend to have greater need for this, but maybe less tapped into global resources such as ours. So we strongly encourage national organizations to contact us. And how do you do that? Very simply, you get in touch with myself or Andy, the program director. I will share the contact details with you at the end of the webinar. And and then we will begin the process with you. We usually start with a call to identify what your needs are, working towards the development of terms of reference and looking for funding, finding the right advisor. So just get in touch and we will start that process. Okay, so thank you very much to everyone who has filled in their details in the chat box. That's very useful. We've got lots of people from all over, including Jordan, Nairobi, WFP HQ, Save the Children. So welcome to everybody and thanks for doing that. Okay, so that's enough from me. Let's move on and hear about the context and the background to the deployment. And I will hand over to Priscilla.
It's past 4 p.m. and I say good evening to everyone. Hello, are you getting me?
Hello, Priscilla. Yes, we can now. We just got the end of what you said. So maybe you could start again.
Yeah, I said, thanks, Ben, for the chance given to me to give the background of the deployment and the context of the country. And I said it's past 4 o'clock in Juba now. And I say good evening to everyone.
Good evening.
Yeah, as most of you will be aware, South Sudan has been in conflict for more than 2 decades. It was the fight between the North and the South. And in 2011, South Sudan gained its independence. And also, unfortunately, right after the independence, just 2 years, then the country went back to civil war again. In 2013, civil war now within South Sudan started, and this placed a lot of people to be in humanitarian emergency, and a lot of displacements, widespread of people moving from one corner of the country to another. And it has been estimated to 1.9 million people that were internally displaced and over 2 million that left the country into the neighboring countries to be as refugees. And because of the conflict, a lot of displacement, and as in South Sudan, most of the population, they are actually living on agriculture. And most of the population in South Sudan, they are actually living in rural areas. And most of these people were displaced. So there was a few people doing cultivation, but because of the insecurity now, everybody was displaced. And it was estimated as to 7.7 million people who were food insecure. And this one plays a lot of stress, especially on women and children, because they are the vulnerable group and the one suffering much. And also, there has been a lot of assessments and surveys that have been conducted. And out of the 10 states, the 10 former states that the country has, 7 out of them have the high malnutrition rate above the WHO acceptable cutoff of 15%. So the malnutrition rates in the 7 countries are above the global acceptable, which is acceptable by WHO. Then there's also other issues that are affecting the nutrition situation, because we have a lot of people are suffering because of lack of clean drinking water, and there's widespread of open defecation, which is leading to poor sanitation, and also health structures were destroyed because of war, and people could not access health services, and especially also children, infants and children cannot get adequate care for their feeding, and there's inappropriate or poor feeding practices among vulnerable children who are from 0 up to 23 months. And this places a lot of strain on them and leading to high rates of malnutrition. And based on this assessments and surveys that are being conducted, the rates of malnutrition remain so high in the country. And in 2019, there were 22 SMART surveys that were conducted, and based on the results that we see, 7 out of the 10 states actually are suffering from severe malnutrition or high GAM rates of malnutrition. Also, in South Sudan, the first national data was in 2010, the South Sudan Household Survey. Since then, there was no any national survey, and the surveys that were being conducted are only county-based. And the county-based survey cannot represent, the national survey. Then in 2018, there was the Food Security and Nutrition Monitoring System, where we integrated indicators for nutrition, for nutrition. Then in 2018, that was the first time that we have a national data of the nutrition situation in the country. Then also in 2019, there were 2 IPC interface classification analysis conducted. And based on this analysis, these are how we got the information of our nutrition in the country. And before the deployment, we can see the data that are shown on the screen. We see when we look at the screen shown here, we are not doing very bad in early initiation of exclusive breastfeeding, because in South Sudan, there's no problem with breastfeeding. Mothers, they breastfeed. Actually, every mother breastfeeds freely. There's no any problem with breastfeeding. You can see early initiation, we stand at 77%. Then exclusive breastfeeding rate, we are at 74%. In 2010, we were 45%, but now 2018, we are 74%. Then we have issues with complementary feeding. Up to now, we still have a lot of issues with complementary feeding because of the displacement. Communities cannot have access to foods that they want. And most of the populations, they're living in IDP camps, and they are getting the dry ration, which is being provided by WFP. So they don't have access to poultry, or meat or fish. And also they don't have access to green vegetables and fruits. So that's why you can see the complementary feeding, we are not doing well. Introduction of solid or semi-solid or soft food, we are at 48%, which is low. And minimum meal frequency for children between 6 to 23 months, also we are doing very bad. We are at 24%. The minimum diet diversity is 20%, very, very low. And the minimal acceptable diet also we are doing bad. It's very, very low, only 7%. So we still have a lot of work to do in complementary feeding, but early initiation and exclusive breastfeeding, we are doing quite well. But we are focusing now in supporting mothers to improve complementary feeding for infants 6 to 23 months. So these are the indicators now for South Sudan. And also in 2017, we're happy to have Alex in country. He supported South Sudan to develop the MIYCN guidelines and strategy, which has been finalized in 2017 and rolled out in 2018. We finalized the training of all our partners. We did a national master training and also TOT at all state level. And now we finalize also the training at the county level. And now we are moving down to the community level to the mother support groups. So actually the development of these guidelines help us a lot to improve some of the indicators that were shown in the previous slide. So although we had these documents, there were some of the things which are still missing. And maybe that one, Yasir can talk about it later on after his deployment. Actually, we've seen a lot of move after his deployment. So we have all these documents. It is in place, already printed. All our partners, they have it. And also at the lower level, because the level of education is really very low in South Sudan, especially among women. So we printed the counseling cards, which is just pictorial. And we have mother support groups in all communities. So these mothers are trained, and the activities are also happening at the community level. So we have the lead mothers training other mothers, even involving grandmothers, to be able to support, the feeding of infants in the community. So it was. We look at in South Sudan, we have the cluster system. We have partners working, and we have the cluster coordinating it. And through the guidance of from the cluster, then it was now how to implement the recommendation, that were provided after the deployment. So this is our situation in South Sudan. The situation is still not normalized, but we can see from 2019 already there's improvement in some of the areas, especially on accessibility. And previously, some of the communities, we cannot access them completely. But currently, there's an improvement, and people are moving, and even our partners are moving, and we're able to access these communities. And the counseling services are also happening in those places where previously we couldn't reach. So this is the background of the situation in the country, and we have partners. We have 39 partners whom we sign agreement with, and we work with the partners, and they were able to reach in most of these communities. Ben, are you there?
Okay, great. Yes. Thank you, Priscilla. Excellent to hear the background to the deployment, the context, the situation in South Sudan. And now we're going to hear from Yasir, who is going to take us through the deployment itself. Thank you.
Thank you very much. Good afternoon, everyone. And thank you, Ben and Priscilla, for giving us a fantastic background and quite a clear nutrition situation and the humanitarian situation in South Sudan. So the thing was like, as Priscilla was mentioning, the Ministry of Health and the nutrition cluster was really keen to make a real move in MIYCN, considering they are very good, solid programming in CIMAM. So they wanted to achieve MIYCN as well. And then the national guideline was endorsed in 2017, which was really a great document to prescribe a set of strategic priorities and some solid guidance on how to do that. And still then, Save the Children, the nutrition cluster, the technical working group was really required to have something which was needed to respond to the priorities that they have identified in the nutrition, the MIYCN guideline. So they wanted to have more technical support in terms of having those specific technical areas, and so that the nutrition cluster, government, and the local or local organizations or the international organizations who are working in the field can have some solid guidance. So the deployment was, as Ben already mentioned, it was 8 weeks of deployment starting from 25th of May until the 20th of July. And it was to support the nutrition cluster to strengthen the delivery of MIYCN response as indicated in the guideline, national guideline. Next, Ben. So one of the objective that the technical working group in nutrition cluster and the Ministry of Health was trying to achieve, they wanted to know what is the exact like current coverage of the MIYCN programming, and what are the gaps that they have in which areas. So they wanted to have a tool which can give them a quick glimpse, a quick idea of which areas are lacking the MIYCN response and what are those things that are being implemented or not. So one thing was this was the first objective. The second objective was the technical working group was trying to have something like so that they can advise the cluster partners who are working in the field when they develop the budget for the humanitarian response plan or they participate in any bidding. So what are the minimum package of MIYCN activities they need to cover in the budget, and what are the basic costing idea they should have for doing a handy budget for the MIYCN. So that was the second objective. So another objective was have like before like in line with the national guideline and the strategies that have been approved in 2007. It was really a need for the wider community to understand the why the MIYCN is necessary or life-saving, in particularly in the context of emergencies. So the country wanted to have a briefing paper that could help disseminating the the nutrition and non-nutrition community, advocating for the MIYCN programming and funding in the context of South Sudan. So a briefing paper was the third objective. Another objective was having a integration plan. So the country already had a workshop that actually identified what are the key things that each of the sectors can do in terms of integrating in the field when they do MIYCN programming or food security livelihood program or the wash or health response. So an integration action plan was needed for them in line with that work, following that workshop. So it was kept in as one of the major objectives outlined here. Next slide, please, Ben. Another one important thing the technical working group was discussing about that South Sudan was very keen, or as per the National Nutrition and MIYCN guideline, the baby friendly hospital initiative was was one of the top priority to be implemented in South Sudan. So they wanted to have a guideline in the context of South Sudan, and also a customized 10 steps roadmap for successful breastfeeding in the country. It was though WHO was a mandate for that as an agency for baby friendly hospital initiative guideline. So Ministry of Health and World Health Organization was working on that for having a draft guideline. So before I got deployed in the country, we already had a zero draft, which was needed to be reviewed from the line from the context of nutrition cluster. So they wanted us to review and give our feedback so that they can take this forward, as well as along with these 10 steps roadmap for the successful breastfeeding in the guideline. So it was kept as a fifth objective during the deployment. The another deployment objective was to have a simple action plan. I mean, simple action plan means it was as it was planned in the national MIYCN strategy and both guideline. It was clearly emphasized that code is need to be implemented. Though South Sudan, like as Priscilla was mentioning, South Sudan has a very good achievement in terms of early initiation and exclusive breastfeeding, as well as the continuation of breastfeeding at year 1 and year 2. And we need to maintain that velocity of exclusive breastfeeding. So, and as the time goes on, so the conflict will resolve with the political stability, then definitely South Sudan is going to achieve more financial strength. So then there is a possibility more and more, as people's purchase power parity improves, so they definitely will move on to the formula milk. So we wanted to have something very good and initiate early, so that that doesn't happen in South Sudan. So we need to have a simple action plan, what to do immediately and what to do next and what to do in phases. So it was kept in as a sixth objective in the deployment TUR. So another one was nutrition cluster partners was trying to have some standardized indicators that can have default reporting in the nutrition information system. And a few of the partners also working in MIYCN wanted to have reviewed their the assessment tools, whether they are complete for MIYCN or not. So it was kept in as one of the an indicator, the objective as well in the deployment TUR. As well as, in addition to that, with having all those things, so there was a necessity. The technical working group, Ministry of Health, and was looking at that everyone needs to get familiar with all these documents, as well as the IYCF-E operational guidance that we have in 2017. So and with all those things, they needed to have a workshop so that we discuss and finalize all those things, as well as get a clear understanding on the IFE operational guidance and the code as well, mostly. So that all are kept in as the major objectives in this deployment. Though a bit ambitious, but still we wanted to have this done so that the South Sudan can move on like in a good pace. So what we did, because the time was limited, only 8 weeks, and we have a lot of objectives agreed on to work with. So what the first thing that we did, we divided among ourselves the technical working group from Ministry of Health, UN, and the international agencies. So we all divided in different groups to work with different objectives. So some people are really working on those gap analysis tool, like NIS people, as well as our technical working group who are working on that. So we wanted to have a small group on this who will work on the gap analysis, response mapping and gap analysis tool. We had another small group who will be simultaneously working on the budget or costing tool, as in line with the HRP that we have in South Sudan. And another group for advocacy brief, another one for integration action plan, who was involved with the ICWG workshops before. So in that way, for each of the objective, like 7 objective other than the last one, the training facilitation. So 7 for each of these objective, we had a small group among ourselves, and then we started working together, at least the mind mapping, brainstorming, and then sharing our ideas. So what we did for the response mapping and analysis tool, we already found that the country South Sudan has already developed a very good metrics for CIMAM. So we needed something that can be easily incorporated. The additional information on MIYCN can easily be incorporated into the CIMAM one, and so that the upcoming nutrition dashboard that the South Sudan NI Nutrition Information Working Group was working on. So particularly I worked with the Information Management Officer in NIS, the UNICEF, Kutab. You know very well, he is very like solid in understanding of this dashboard. So he worked with me and then identified a couple of things which can be immediately done, included in the dashboard, which can be done at in a later phase. So we have identified a gap analysis tool in that way. And then we kept it for the partners. We shared it with the partners so that they can have a look at it, and they can feel as a as a piloting or testing, field testing, and then share their idea with Kutab, so that Kutab can maximum respond, include them into the dashboard. The same way that we had one, we had the MIYCN program budgeting or costing tool. So we identified in a small group, we identified our the minimum response activities for MIYCN, which can be done in the context in line with the HRP, and what the minimum budget that they may need, in line with the existing guideline that Priscilla was indicating, developed by Alex in 2017. So we tried to realign all those national guideline and strategies with these activity identification. And after that activities, we identified what are the minimum standards for each of these activities and what are the budgets that we may need to include. So we had quite a small and easy to understand tool that the partners can use for their next HRP. And for advocacy brief, we also worked in a small group. We like from UNICEF, WFP, Concern, and Save the Children. So we all worked together and we identified what has happened before, what kind of advocacy brief that we had. So we found one advocacy brief was developed back in two years back for targeting the journalist only. So we take it, and we also did like ND and Alex also shared a couple of advocacy brief that WHO has, UNICEF has. So we all taken the all existing advocacy brief and tried to incorporate them as much as possible for in the context of South Sudan. So we had an advocacy brief after that, and which was shared with to everyone, and whether it brings any an appeal for the non-nutrition actors like donors particularly. So we wanted to at the end of this the deployment, we had a very handy and small like 2-pager as an advocacy brief. We also had an integration action plan working with these small groups. So we went to the field to observe the FSL activities and WASH activities, as well as the health related activities that are ongoing in the refugee camps. Then we found that what are the maximum things that we can do in line with for each of the sector, in line with the ICWG workshop agreement that we had a year back. So what we found, there are a couple of things are missing that particularly at the strategic and leadership level. So it's very clear what are the things that can be done, like what MIYCN activities can be done by the FSL team, what MIYCN activities can be done by the WASH team, or from the health contacts. It is not really very rocket science, but the thing is, one thing is important, that is strategic and leadership level. So what are the actions that can be done during planning phase? What are the actions that can be done by each sector during assessment phase? What are the actions that can be done at the implementation and monitoring level? So for each of the, we identified each of the stages and who will do what, by when, and how it can be measured after the implementation. So we kept all those things in our action plan so that the partners can follow, the leaders can take a move, a solid move from that. So we had these outcome after the deployment. Next one, please, Ben. As I was indicating, that baby friendly hospital initiative, we already had a zero guidance developed by the WHO team and the Ministry of Health colleagues. And then they were really keen to have a look from our nutrition cluster colleagues. So I deliberately facilitated that with our technical working group team members, again in a small group. So not everyone was engaged with this. So I was I took a couple of our colleagues, and then we reviewed it, and we found that what are the gaps that are existing in this zero draft, and how it can be improved from the nutrition lens, particularly in terms of 10 steps roadmap. And so we agreed on that, and we when we worked with the WHO team after that, and then they were really happy to move that forward, considering our feedbacks. And with all those 10 steps action plan, they were really seemed to be very happy, and then they wanted to have a wider technical working group for each of these sections, as indicated in our feedback. And then they are ready, like from the next month, like maybe August or September, they are planning to start that a technical working group meetings for that. And for the 7th action that they are mostly working on, like we are working on, that is the code implementation action plan. So how South Sudan can emphasize on the implementation and monitoring of the code of breast milk substitutes. Then we found that considering the current we
yes. Yes, sir. Yes, sir. I'm not sure if
yeah,
it was the same for everybody, but you went away for about 10 seconds then. So could you just repeat what you said?
I also guessed that. Yeah, thank you, Ben.
Okay.
So the thing is like for the code implementation plan, we found that what are the things that we need to move on fast, like in the initial at the initial stage, and what can be done at the later stage. So we found that the awareness was pretty low in South Sudan in terms of what the code like what is the code and how what are the minimum code implementation like what steps that we can do. So we found that let's start with the phase one. In the initial phase, we start with the bringing like more awareness on the code, and then on the second stage, we will start in the midterm action. We can initiate the monitoring and reporting of the violations, and in the final stage, we can do adoption of the code as a national legislation. So we have identified for each of these steps what can be done, who will be responsible, and what expected outcome we can expect by when. So our status to date, so with that we can monitor the outcome of each of the stages, starting from awareness building to monitoring and implementation to having a legislation. So we have that after the deployment period. And lastly, what we wanted to have during this deployment period, we found that South Sudan was really moving really fast with the MIYCN implementation. So there were a couple of training sessions already planned. So they wanted me, and the country wanted me to be in the training facilitation role. So as one of the trainer for incorporating mix emergency context most like as much as possible to maximize my outcome of the stay. So there were a couple of training batches were planned. So I was 5 days. I was facilitating the training session with Ministry of Health and UNICEF and WFP, and as well as the technical working group. We all are there, and then we conducted a training session, which was later facilitated or cascaded in the state level. So that is that's all about the deployment achievement that we try to make from the out of my the 8 weeks of time in South Sudan. Couple of major facilitation point that I would like to make before the challenges. The country was having immense like kind of energy and kind of I should say the commitment for MIYCN and improving the IYCF in the country. It was really appreciable. Is like considering the context that Priscilla was indicating, it was not really easy for South Sudan to mobilize the resources in the context where it is the emergency is not in a point that the more funding is coming for MIYCN. It was not that easy. So even then, Ministry of Health and UNICEF, WFP, and overall the technical working group in the nutrition cluster was really keen to implement the MIYCN as part of a package of nutrition. So one of the things. Another thing is, despite the fact that there was no specific like the nutrition cluster was very active, but the technical working group in the country was not really that much active that we found. But still, they were. Still they were trying to get a regular meeting, regular sharing of their of their progress and ideas with the MIYCN, how they can. So the commitment again it comes. Still, I found as one of the a couple of challenges that we have faced in South Sudan, particularly delivering these outputs. We found that many of the activities that we have done before, which was not really being stored in a way that everyone can access it anytime from anywhere. So it was not really easy for me as well to after reaching there to identify all these documents, what have been done before, what was not done. So I have to move forward, like move desk to desk to the key technical working group people and get a hold of those. So it was taking some time for me. And because of the intermittent connectivity issues, I would say it's intermittent connectivity issue is one of the thing is like the country team was very busy with a lot of activities. So many of the agencies has many other priorities for these competing priorities, as well as the training session that was going on at that moment. It was not really easy for everyone to be with me while developing these eight like deliverables or objectives. So the thing is, that's why our idea of having a small group was a major task. But still, it was not really easy for us. And scheduling and organizing field trips, yeah. So when it is really very difficult, because we need prior approval wherever we move in South Sudan. So these approval procedure and like not able to move frequently in the field, and organizing meetings with the external partners like WHO, as well as the external to nutrition team, which is NIS, Nutrition Information Technical Working Group, who are working on different agendas. So it was not really easy for us to mobilize everyone as per our schedule. So we had to adjust a couple of schedules. And another thing is, for this 8 weeks deployment, target eight different kind of set of objectives was really ambitious, particularly when the country was really looking for a fast move on this MIYCN implementation of MIYCN. They wanted to have this, but they were ready to have couple of deployments. It was not really for one deployment, but still it was not feasible for to wait for another deployment. So we had to do all those things in these 8 weeks time. We had to take the challenge of delivering these 8 targets in 8 weeks deployment. Next. So I would like to hand over to Priscilla for that. What is ongoing after having all those things?
Thank you, Yasir. Priscilla, are you there?
Okay, yes, I'm here. Thank you. What's ongoing now is we met again with the ministry and WHO and went through the 10 steps of the BFHI, and we started working together with them, but we realized that WHO, they have limited staff, and they have only one staff who is doing so many things. It has a lot of commitments, but we really need to follow up with him. And he also requested that he will ask for technical assistance from their headquarters. So we are still following up this with WHO. But already after Yasir left, we had a series of meetings with WHO and the ministry actually is keen, and we have a Kamisa, she's pushing to get this one done. So on the MIYCN-E program budget costing tool, and we are glad that we have this tool. And previously, even in the, when partners apply for funds in South Sudan humanitarian, the South Sudan humanitarian funds, through the cluster, it was difficult to get funding for MIYCN or MIYCN-E, because the cluster was even asking us, how do you budget for that? Because for CMAM, it's already there, it's easy. They know 1 carton of RUTF is $58 and they know everything. But we are glad now that we have this tool, and our partners are able now to use this tool. And in the proposal, they have budgeted for MIYCN-E activities. Even for our UNICEF program, last year we only have very few partners who have factored in actually, or who have costed the budget for IYCF-E activities. But as I speak now, we have finalized our PDs for 2020, and all the 39 PDs, they budgeted for IYCF program in their document. So we are glad that this one is working very well. And the next one is there's also ongoing discussions with the ministry leadership on the policy and strategic actions. And this one, in August, we had a meeting with the ministry, the undersecretary, the minister was there, and we raised the issue of policy. For now, nutrition, South Sudan nutrition, there's no nutrition policy for South Sudan. We have a draft that was prepared in 2005, and up to now, it has not been finalized. Then the government actually committed that they will push for South Sudan to have the nutrition policy in place, and also the code, because we have seen there are some violations happening, but now nothing can be done because the code is not in place. But we are glad because we have the document that Yasir helped us develop, and especially in the displaced camps, you know, it was easy. One incident happened in Juba, and we were able to address and stop that partner from distributing, you know, the formula. But it's happening in community. We have also other faith-based organization or charity organization. They think, you know, donation of breast milk to infants or to orphans is okay, but we are also trying to address this. But because there's no code in place, and it's difficult to convince, you know, the partner doing this. But this has been discussed also in August, and the minister and the undersecretary plus the acting nutrition director, they are really pushing this, and they want to have this one done. I think by the first quarter of 2020, this will start moving, you know, forward. Then the reporting on MIYCN by the cluster, this one is happening. It has really improved, and on monthly basis, we are getting information on the indicators for MIYCN being captured in the nutrition information system. This is happening. Then the annual review on MIYCN coverage and prioritization, this is also happening because we have seen from the FSNMS surveys that are conducted, we have introduced indicators for MIYCN, and now it is being captured, and the report is compiled based on county-wise, then also state, then at the national level. So now it's easier for us to know which county is not doing well or which state is not doing well, and we can prioritize our activities based on the coverage report. So this is what is happening now. And can you move to the next slide, please? Yes. Then also the dissemination of the action points from which was left during the deployment with the cluster members. This we had discussions with the cluster, and some of the cluster members already, because they are also members of the technical working group for MIYCN, they are aware, but this has not yet been widely circulated because there are some few things that we need to do with the cluster before sharing it widely. But already in one of the CMAM technical working group meetings where our donors are also present, it has already been presented. Then the progress on tracking, particularly on the application gap analysis tool, we have the BFHI guidelines and MIYCN integration. This is also already on track, and the gap analysis tool, like for UNICEF, we have already started with our partners with last year we have 40 partners, and we already did with them some analysis to find out what is not working well in the MIYCN. And this also gave us opportunity to see where we didn't do well and be able to improve. But now in the PDs that we finalized, we have already looked at each of the PDs and stress to the partner where they should improve in integrating the MIYCN activity into their program, because we have other partners, they were doing CMAM and they were not doing MIYCN activities, but now in all the PDs it has been integrated. And the last point is the ongoing capacity building. So like I mentioned earlier, we did the master training and TOT training, and the training at the county level also were finalized. And now what is ongoing is training at the community level with the mother-to-mother support groups and the community nutrition volunteers. This is happening, and we put money for 2020 in all the PDs or program documents so that the partners will roll out this training. And previously we had very few community nutrition volunteers, but in 2020 we are going to use them because they are the people working at the community, and they will be able to reach mothers with information on IYCF, or maternal, infant, and young child nutrition. So the capacity building is ongoing, and we are going to strengthen it further in 2020. So this is what is ongoing in our country. And there are some of the conditions that will help us continue to sustain this problem. The first one is dedicated focal point at the MOH to lead the process, because we have the ministry, yes, but we need somebody who is dedicated. We have someone who has been appointed to be the focal point for MIYCN, but the person is not very stable. Most of the time, the person is traveling, but for us to move forward, we need really a dedicated person to move forward and be able to push, this agenda from the ministry side. Then the second one is prioritization of MIYCN-E by all actors, partners, UN agencies, and donors. And we have seen previously, even we are not getting money for MIYCN activities. Even Yasir mentioned earlier that in the MIYCN technical working group, it's not that very active. Actually, there are only 7 people attending that meeting when we call for MIYCN technical working group meeting. But if you look at CMAM, even donors are attending that meeting, but we have never seen any donor attending our MIYCN meeting. So for us to move forward, we want all actors to prioritize MIYCN-E, like for donors, for funding, and also our partners and all the UN agencies that are supporting nutrition program. So this is what is ongoing now, but we will also push from our side, work together with the government, and also through the cluster to engage all the partners and our donors. Thank you.
Excellent. Thank you very much, Priscilla. And also thank you to Yasir. So, what struck me most about this presentation, and I think Yasir touched upon it, we've already had a question related to it, was the remarkable amount of work going on in South Sudan in regards to IYCF-E generally, but specifically with this deployment. And it's really also struck me, again, touched upon by both Priscilla and Yasir, the commitment of IYCF-E across the board, it seems, amongst NGO partners, amongst donors, and also amongst the Ministry of Health. That actor has been discussed less It would be maybe good to hear about the engagement from the Ministry of Health. And finally, it's really excellent to see the ongoing work following the deployment. Obviously, the deployment happened in May, and it seems like a lot has been going on since then. There's something with the Tech RRT that we try our best to do during our deployments to facilitate, to do the groundwork to enable the in-country actors to continue that work that was done. But it's not always in our hands, obviously, and it relies on the commitment of those in country to continue it. So it's great to see that it seems that that's happening. So maybe we can, on one of those notes, I can ask a question that was posed by Martha in relation to the number of outputs that were accomplished during such a short time. And Martha says, how did you manage to get all that done in such a short time? So Yasir and Priscilla, maybe you can touch on the factors that facilitated you being able to achieve so much in such a short time.
Thank you so much, Martha, for raising an important question. Since I have been in the field, I was like hearing this question many times. So it is really a worthy question. The thing is, we also acknowledge that the TUR was really ambitious considering that time period that was allocated. But as I was asking, the country was really needed these things immediately to realize that for the practically implementing the strategies and guidelines that they have since 2017 when Alex was there. He was supporting developing this, and MOH already endorsed it. So there is something they needed immediately. So it was really urgent, and things like that. Country was really ready to have another deployment after that. If I cannot to have all those things. So we had to be ambitious. Since first day, everyone was on board. When I arrived, arrived in the country. So we had our meeting on the first day that what are the maximum things that we can accommodate in a team. So it was a really nice support from the Ministry of Health, leading from the Ministry of Health and UN, and we identified, okay, let's try, we can achieve in a team. So that's why we identified our small groups from the technical working group. Even the technical working group was really not that much active that Priscilla was indicating. So we had to find additional people who were not really engaged before, but we engaged them to maximize our groups, to enlarge our groups so that we can work on together. So that's how we identified like 15-20 people even sometimes for all these activities, and that's how we achieved. It was really a team effort, I would say, but I have seen immense kind of energy in the Ministry of Health to take lead on.
Great, thank you, Yasir. And also, Yasir, you mentioned that Alex and Andy supported you on the advocacy note. So did you have did you have much more support from outside of the country, remote support, and how did that help
yes,
you to achieve the objectives?
To achieve all these objectives, I think the two most important person that I have received, I would really say, one is Andy, another is Alex. So you know, Alessandro Lemalo is our global IYCF-E technical advisor in SCUK. So he was really always keen because he understands the context. He has already developed the supported the country in developing the national strategy and guideline. So I was really confident that whatever we are saying now, we are saying in line with that already endorsed guideline and strategies. So starting from the gap analysis tool, advocacy briefing paper, indicators, code implementation plan, I would say, and many more. So every time we have got considerable amount of support from the center, from Andy as well as Alex. So that also one of the factors that helped us to achieve these things without having a second deployment.
Okay, great. Thank you, Yasir. maybe I can now refer to a question from Alexa. So Alexa says, what do we estimate are the influencing factors for the poor performance for complementary feeding? And what opportunities are there to tackle this? Priscilla, would you like to give us some insight into that?
Yes, thank you for that question. Actually, like we've seen from the presentation, our indicators for complementary feeding are really very low. So this is one of the reasons is because of the displacement of the population. So people were displaced, they live in camps, and there's no opportunity for them to grow vegetables. Like I said, in South Sudan, we have 2 groups of people. We have those who have cattle, they look after cattle, they have milk and meat, and we have also people cultivating, growing crops. And because of the insecurity now, even most of the cows were lost and people were displaced, they cannot cultivate, they depend on food aid. And food aid, we know this is always dry ration. So when we talk about complementary foods, like we have in our counseling cards, we have varieties of food. And sometimes it's really very difficult for us to counsel mother and show them these counseling cards while they are in the POC. We call it POC, protection of civilians in the camp. They stay in the UN camp. So it's difficult. If you show mothers, they'll ask you, you are showing me fish or meat or chicken. We don't have it here. So it's becoming really not easy for us. You know, they are getting the dry ration, also is fortified, but still, you know, when you show them the counseling card, they'll say, okay, we don't have this. So because of the insecurity, they cannot have access to variety of food. They can receive only the dry ration from WFP. And this one will affect actually complementary feeding. And the second thing is also in the communities, in other communities who can access, you know, vegetables and other sources of food, there are a lot of food habits and taboos. And some of the foods are forbidden. You know, in other communities, they said you cannot give eggs to a child before the child is 3 years old, before the child can talk. They say the child cannot talk if you give eggs to, you know, a child before the child starts to talk. So they will not give eggs. They will give other foods which has low value. Then it will affect our complementary feeding. And one thing also which affect complementary feeding in South Sudan is because of the war and because of the economic sanction, you know, things in the market are very expensive. Although meat is there, fish is there, milk is there, everything can be there in some of the places, you know, mothers cannot afford. So they don't have money, or the money they have is too little to buy milk. So they can buy, you know, low food value to give to the children, and that's affecting, you know, the feeding of children and leading to actually malnutrition. And in 2019, we estimated 300 children to be suffering from severe acute malnutrition. And all this is related to inappropriate infant and young child feeding based on the conditions that I've mentioned. So for me, these are the issues actually contributing to high malnutrition rate. But to address this, what we are doing now is through our partners, we put some money in the partners to be put in the document that we signed with the partners for implementation in 2020. Every community, they will have backyard garden. They'll have backyard garden. They will teach the mothers how to grow these vegetables. Even in the camps, there are no space, but we are teaching mothers how to grow vegetables in the sack or in the broken tins because of lack of space. But in the community where there is space, there will be community, you know, garden. Yeah, even in the sterilization center. So these are some of the ways that we want to actually improve the complementary feeding in the country.
Yeah, just to add with Priscilla, with all these functional barriers, one of the major overarching issues that we have is like low coverage of IYCF counseling, one-to-one counseling or group counseling through support group or through the essential health contacts. It was pretty low. So compared to the exclusive breastfeeding, which is really instinct, the complementary feeding is really challenging for the mothers, which is need to be teach them. Like we need to teach them, we need to aware them. So without these awareness sessions or counseling, it is really difficult for the mothers to get hold on those typical like technical issues. Complementary feeding is really technical.
Excellent.
Yeah.
Thank you
Great.
for raising this.
Thank you.
This is a very good suggestion, and if we want to inform you, this year PD amendment for all partners, as Christina has also informed you, that first output is we have taken a very strong MIYCN counseling activities, and it is concentrated around the complementary feeding, not much on the breastfeeding, because breastfeeding is we already crossed more than 74%.
Yeah,
so more focus is on
Great.
this, and for this in our PD we have put the feeding demonstration session, then also the kitchen garden development, community garden development, giving them seeds and all. And the third thing which we are focusing along with these two, and also recipe preparation. So we are collecting a compendium. We have already started working on it. So by February it will be ready. Preparing a compendium of the locally available food items and how to use them in the regular home cooking. And then once that, then we will train the CNV, and also the CNV is the community nutrition volunteer. So their number has been increased, and instead of just leaving it on the partner's choice or the community's choice that we want this number or that number, program work like nutrition section has worked and developed. We decided the number of CNVs per household. So it's 150 household per one CNV. Their roles and responsibilities also described. This is a cost sharing between WFP and UNICEF, 50-50%, so that instead of one, we can have two in one community. The overall number will be increased definitely, because we set a target of the population. So it will, so the displacement of the population will not affect the number of community health nutrition volunteer available to work with the community.
Thank you very much.
And then we have also decided on a
thank you,
fixed,
Vedana.
Just $36 per month for the 12 visit in a month.
Great. Thank you very much. Just so you know, Priscilla's second voice there was Vedana Joshi from UNICEF. Thank you very much to you both. Thank you very much to you both for your inputs on that question. So we have less than 10 minutes now, so I'd really like to move on to another question that we have in the chat box. And if anyone else online has any other questions, now's your last chance to get them in.
Claude has another question.
Ben,
Claude,
can
yes,
I say something also?
Yes, Shishe, can I just get to Claude's question? Otherwise, we will only cover 2 questions.
Yeah, it's not a bit a question about, but in addition what Priscilla and Vanana has said regarding the complementary feeding.
Okay, just 1 minute, please.
Yeah, 1 minute is one of the issue we have to consider is also on the behavioral aspect, the SBCC, which we have to do a lot. But all I agree with them, but one of the important aspect is the gender aspect, which we have to touch also, especially the available resource to women and ladies. So from WFP and other partners, what we are like the gender, the general food distribution and safety aspect, we are trying to target more to the women so that they can access for food and other resources for complementary feeding. This is one of the aspects. But in general, it needs detailed assessment regarding complementary feeding.
Great. Thank you very much for that addition, Shishe. So we don't have long left. I'd like to move on to another question, if that's okay.
Just reply me, the concept note which WFP and UNICEF created together is also mentioned about the equal number of selection or nomination of male and female in CNV.
Yeah.
Great, yeah.
Okay, great. Thank you for that addition. Okay,
Ben,
yes, I'm just going to move on to Claude's question, please.
Claude, are you there?
Great. No, I think Claude messaged me. I think he had to go to another call, but
Okay.
let's answer the question anyway, because I think it was one that I thought of as well. So why is breastfeeding not a real problem, as Priscilla outlined? Why such good, well-performing indicators, firstly? And secondly, what can other countries from South Sudan, what can other countries learn from South Sudan in dealing with breastfeeding-related challenges? So just bearing in mind, we've only got 6 minutes left, so we'll need a brief response to this one. Yasir or Priscilla?
Priscilla?
Yeah, this is Priscilla. I think we presented that the breastfeeding rates in South Sudan is okay. We are at 74% of exclusive breastfeeding rate, and this is because in South Sudan, every woman is encouraged to breastfeed. Traditionally, yeah, this is deeply rooted. Every mother has to breastfeed, and there's no any fear. A mother can breastfeed anywhere she is. If she's in the market, she's in the church, or she's on the street, she can breastfeed. So there's no fear about breastfeeding. And secondly, in South Sudan, actually, many women are really, uneducated, or they have very low level of education. If you see women doing bottle feeding, these are women who are educated. And the majority of women are not educated. So for them, they go for breastfeeding, which is natural. We have issues only with the women who are educated, and there are very few. And those are the ones doing breastfeeding and bottle feeding. Now, for what we are doing now, also we encourage. The issue is they do breastfeeding, but they don't do, exclusive breastfeeding. That's one issue which we have in South Sudan. They breastfeed, but they give other things. Yeah, they believe. Yeah, they believe that a small baby or an infant will be thirsty. They also give what? They give water or other herbs. They also mix, and they say this one will relieve the pain. But now what we are doing in MIYCN, we are really encouraging them to do exclusive breastfeeding, not giving even water unless the baby is sick, so the baby can get medication. But now this is being understood by most mothers. That's why we are at 74%. We do a lot of awareness to the communities, through the mother support groups. Even in the facility when they come, we do counseling to mothers to understand that a baby doesn't need water before the age of 6 months. So that's why we improve, the rate of exclusive breastfeeding up to 74%.
Excellent. Great. Thank you very much, Priscilla, and thank you to those for their questions. We have only 3 minutes left, so I'm going to take this opportunity to wrap up. And in doing so, I am going to refer to another question that apologies if I pronounce your name incorrectly, Tembisani asked. Okay, just put him on mute. Tembisani. So Tembisani asked, is it possible to share the updated NIS database and templates capturing the MIYCN indicators? So we often get, as you would expect, lots of questions related to sharing of the tools and the outputs. So Tembisani, I will have this discussion with Priscilla and the in-country team to check if it's possible to share, of which of the outputs it's possible to share, and we will make those available to everyone those that are possible to share, available to everyone who registered and attended the webinar. So thank you very much for answering that. And on that note, we will also share the slides and the recording of the webinar I will do that as soon as possible. And I would like to congratulate all of the work of the technical working group in South Sudan. I'm not going to mention any of the participants out of fear of missing anyone out, but please pass that message on to all of those members of the technical working group that supported Yasir and contributed to the work that we have discussed today. And I'd like to thank you all for attending the webinar today. We had a great turnout, even the week before Christmas. So thank you for that. And finally, it would be really, really great if those that attended could fill out the evaluation. I am right now going to paste the link into the chat box. This really helps us to improve these webinars, and it will only take you between 5 and 10 minutes. So I would be very grateful. And on that note, I would like to wish you all happy holidays and happy new year. And we look forward to being in touch in whatever capacity in 2020. So thank you to Priscilla and Yasir and everybody who attended today.
Thank you so much, Ben, and everyone. Have a happy holiday and have a great new year.